apologize if you can't read these slides. I want you to know that the slides don't have really anything important on them. They're just mostly pretty pictures that I made to kind of keep me on track. And I'm going to keep my notes up with me so I stay on track, I'm hoping, but just going to do a tiny introduction of myself. I'm a 1999 Oregon State grad. And at that time, we still had to go to Washington State for part of the program, so I actually have degrees from both universities. But now Oregon State does all 4 years on site, so that's pretty exciting. I have on and off over the years done quite a bit of shelter medicine with cat adoption team. I currently do some relief work also for Salem Friends of Feline down in Salem. So I recognize some of the faces from Salem. The veterinary world is very small, especially the cat world. So it behooves us to get to know each other and be friends. I am certified in veterinary acupuncture. I went through the Colorado State program in 2008. I do love acupuncture in my relief work. I would say about 80% of my acupuncture is dachshunds and German shepherds. And which is kind of sad for those dogs, but I don't do a ton of it on cats. And if anybody wants to talk to me about that, I'd love to do more cats, but we can talk about the challenges of acupuncture and cats. I'm currently working on my board certification in feline medicine. I hope to be done in about a year and a half. A lot of people don't realize that there's 2 ways to get board certified in veterinary medicine right now in the United States. You can either do a residency through a university, which will take 4 to 6 years of your time and you make nothing. And then you still have to take an exam to get all those letters. But we can do this also through a process of education, submitting case reports, and a national board exam. But, there's now even a shelter medicine has a program. Emergency medicine, there's equine, but feline medicine was one of the first ones, and there aren't very many of them. And so I'm hoping to join this group here in the next couple of years. Cats are my thing. I've been in general practice, really, even now I'm still doing relief work in general practice, but cats have always been my favorite, and in the large groups where I worked, everybody sent the crazy cats to me and their owners. Which is fine. We get along great. I think the thing that you have to take away about cats is that you have to be incredibly patient and incredibly creative with cat people, too. My other veterinary interests include the PVMA, that's the Portland Veterinary Medical Association. I've served on the board twice, but they are a great organization for the local group here in Portland, do a ton of nonprofit work for the community, but they're also a great social outlet as well as CE for veterinarians in the area. A lot of people don't realize that I also do equine rehabilitation, but this is my hobby. It's something that I started with a group in Wilsonville. I didn't start the group. I started with the group about 10 years ago. So I have one horse. This should be the rule with cats as well, but I have one horse that we've spent the last year rehabbing, so it's pretty exciting. If anybody wants to talk about equine rehab, I do not practice on horses, but I will talk to you about rehab if you have questions about that. Okay? So, I'm sorry if you cannot read this, but your list of resources are actually in your notes. So on the back of the paper, I want to say that 98% of the information that you hear today came from one of these sources. And the reason I thought that was important is that these are reliable sources that are updated fairly regularly and written or at least reviewed by veterinarians. Okay? And so when clients especially want to learn more, I have something I can go to that they can look at that's very user-friendly. And a lot of these organizations are also linked to nonprofits that do tremendous animal welfare work. So it's a win-win. But that would include, I have the Merck manual up there because if you have a question about pigs, go to the Merck manual. I don't have any clue. But I love International Cat Care, the Companion Animal Parasite Council, Cornell University. American Association of Feline Practitioners, Ohio State, and UC Davis. And of course, hopefully your local veterinary office is a good resource. Don't drive them crazy with phone calls. If you have really a legitimate phone call about your cat, okay, call them. But I do love these resources, so I tried to stick with stuff people can find and use that's reliable. Dr. Google is not as scary as people talk about it, but the thing about Dr. Google is that you will get a huge amount of information, but the depth is like this, okay? So us as animal welfare professionals especially, where we should be getting paid for our time is our depth. Okay, anybody can search and you can get a little something about almost anything, but you're not really going to get the depth to understand how it works in context, how does it treat it, what's a long-term situation, okay? So I'm happy to have clients look up information, but they do have to realize that the depth of it has taken me 20 years to get here. So usually when they start to fish that out, they appreciate being able to access it, but pay me a little bit for my time. If you want to actually have in writing any of this, I'm happy to email this document that I did write, but none of this information I discovered. This is stuff that's available to you. I just want to put it in context of how we use it, okay, and what it's going to mean for everybody who's out in the animal welfare world. So, the title of the talk is A Tale of Infectious Disease, because, you know, cat tail, we love cats. But it's really more like a tour. I'm like a tour guide. We're going to go on a drive. Because to me, I think that none of these diseases exists all by itself. It has to do with the biology of the cat, the natural history of the cat, the behavior of the cat, and how we live with cats and other environmental things that go on with cats, okay? So this is sort of a tour, and we're going to stop along the way in the places that I think are the most clinically important. You know, if you come from a facility that has leukemia cats, you've got other issues that are going to be more important at that level. But I'm trying to keep this super global and usable. And keep in mind, this information changes all the time, and I don't have every single fact maybe correct. That isn't the point. The point is, I'm going to try and walk you through what I think is most clinically relevant right now in the global spectrum of cats as pets, okay? So when I see a cat for an exam, especially a kitten or any cat with a fever, I don't care what age it is. If I see a kitten or any cat with a fever, I have my go-to list. I want to know if it's got fleas, ear mites, does it have any upper respiratory symptoms, does it have diarrhea, could it have ringworm, and could it have FIV, so feline immunodeficiency virus or feline leukemia virus. It is my job to try and explain to the client how we're going to get that diagnosis if it's not super easy. And we're going to go through each of these. It's my job to try and explain treatment with what we have right now available to us. I need to try and help them understand, is this going to be a curable condition? Could this be a lifelong problem? And I want to know if there's an environmental issue. And honestly, this is what it all comes down to. So we're going to come back to this over and over about environmental issues in cats, okay? They are incredibly sensitive animals, but they hide their symptoms, but they internalize them. And so a lot of this leads to chronic illness, okay? So I need to know, as politely as possible, I want to know if it's coming from a situation that's not so good. Is what kind of stress do we have? What are their total parasite situation? Are there dogs in the house? Are there children? Like, I need to know what else is happening in the home. I need to know if there's adequate nutrition. Finally, it's my job as a veterinarian to understand if this is a zoonotic disease and if it has any relevance to the family. Okay, so zoonotic would mean that, let's say, for example, I see a kitten with ringworm. I have to disclose to this family that ringworm is contagious, and probably the kids are going to get it. I kind of think it's no big deal, but we need to talk about those things because I was explaining to everybody who will listen to me that the only thing that's important to me is that this family bond to the cat. I honestly don't really care what I have to deal with. I need to make sure this family understands these issues so they will bond to the cat, because if they don't bond to this cat, they will not take care of it. Okay, so zoonotic disease is a big deal, and we're going to talk about that a little bit later too, with infectious disease in cats. I'm going to go right to fleas because this is me hiding my face. I should love fleas, and I hate to be cynical, but fleas are going to pay for my kids to go to college because fleas, so everybody has spiders in their house. You might have one spider, you might have 1,000 spiders, but fleas are no different. In my opinion, everybody's got fleas. They are everywhere all the time. You might have one, you might have 1,000, but they are everywhere. And I swear to you, clients would rather believe that their cat has cancer than has fleas. Fleas are usually easy to diagnose, and they are treatable, and in fact, they're preventable. I kind of love them for that. What makes me nuts is trying to convince clients that we want to find fleas, not cancer. Okay? Fleas are incredibly annoying, though, because they do carry tapeworms. They carry two very serious blood-borne diseases, Bartonella and Hemabartonella. So Bartonella is cat scratch fever. Okay? Darn NPR just published another article about how cats give people Bartonella, or more people are getting sick from kissing kittens. Anybody see this article? Don't kiss kittens. And I'm like, oh, really? So I read the article, and it said immunosuppressed people who are living longer, and there are more of them because they live longer, probably shouldn't kiss kittens with fleas. Are you kidding me? Yeah, okay. Right. If you are immunosuppressed, cats are probably not a great choice, but please treat them for fleas. I mean, that was the bottom line. Hemabartonella is a blood-borne disease that cats can get from fleas, and it does kill cats. It causes a life-threatening anemia. It is treatable if you catch it in time, but serious nonetheless. Okay, so, and in kittens, Randy helped me rehab a group of kittens. We almost lost, 6 weeks ago now, a month. The kittens had so many fleas. It was really hot. It was like 98 degrees outside. Barn calls me up. They've got a litter. They caught 7 totally flat, dehydrated kittens, crunchy with flea dirt. And when we bathed them, when Randy bathed them, the water was blood red. It was like puddle, like squeezing a squeegee of blood off of these babies. So it'll suck a kitten dry. They get out of control of the population, they'll suck that kitten dry, and you're done. That's it. Ain't gonna live. So prevention's the best medicine. We have great flea controls on the market. They are expensive, okay? So people like to collect cats, and it annoys me because cats are easy to collect, but they can be kind of expensive to treat. And if you have 5 cats and every dose of flea control costs you $15 to $20 a month, did you budget for that? Again, I hate to be cynical, but fleas are super annoying and expensive, but they are preventable, and I think people need to budget for that. And if weather issues continue this way, it is going to get worse. So for me, it's a budget issue when it comes to fleas. This is a cat I saw. All these pictures are patients that I have seen in the last 2 weeks because I was so prepared. This cat, it is kind of tough to see, but this is a black cat, and he came to us with a dermatitis, and the cat was covered in super thick, nasty crusts. Now, his fleas were easy to diagnose, and but I want to use this slide to impress upon people that this could be ringworm, this could be ear mites, this could be autoimmune disease, this could be a drug reaction, this could be a food reaction. I mean, the list goes on and on. This could be Demodex. So if I really couldn't identify the fleas fairly easily, or the owner wanted to pursue a biopsy, you'd want to biopsy this lesion because that could be anything. And the other point to this, and we'll talk about bacterial diseases in cats, but we do a lot of cultures now because it's medically the right thing to do instead of just throw antibiotics at everything. Okay, and I cannot tell you how many more of the methicillin-resistant, antibiotic-resistant MRSA staph bacteria I'm seeing, okay? This cat looks very similar to a squamous cell carcinoma patient I saw that had a huge tumor. It looked just like this. This can be skin cancer. It wouldn't heal. We knew it was cancer, but we were having a really hard time with it, and it turned out to be an MRSA infection on top of the cancer. Well, that's contagious to people, or the human gave it to the cat. It doesn't even matter, but it has to be handled really carefully because this owner wanted the cat to live as long as possible with that cancer, and now an infectious bacterial problem on top of it.
We can bring that up at the end on this video over this
Great.
over here if you guys
Yeah,
want to get a little
this was a great case because this could be just about anything. I happen to know it for sure it was fleas. Okay, that's all I'm going to say about fleas specifically. We'll talk a little bit about ear mites because they're super common. Ear mites are a little bug that love to live almost exclusively in the ear of the cat. They don't really like anybody else. They don't like humans. For some reason, King Charles Cavalier Spaniels, there are a few weird spaniel cases that I see ear mites. Or puppies in general. I think it's an immune dysfunction. I think the higher bred the dog, the less likely it has a functional immune system. And ear mites will live in there. But ear mites, again, if you diagnose them early, they're really easy to treat with a little bit of ear cleaning, a dose of Revolution, or some ivermectin. But if you don't treat them, that cat will either shred its face off, shred its ear off, the ear will crumple and close the ear canal, and now I have an ear canal I can't get into. And the glands in their ear canal will turn into these tumorous growths and eventually rupture that cat's middle ear, and it will kill this cat. Now, it will take 6 to 8 years for all that to happen, so I've now have a miserable patient for 6 to 8 years with an ear I cannot treat. You can physically remove the ear canal. That's a very risky, inexpensive procedure, okay? Ear mites are no good. Get them treated, get it under control. It's another population issue, in my opinion. Okay, if you have too many cats and you've got ear mites, I don't want to hear that it's too expensive to treat, because 5 years from now, you're going to have a house full of cats with bad ears. And to remove that ear canal surgically, even if the surgery goes well, $3,000 to $4,000. That's a lot of flea control and ear mite control we could have bought instead. So it's one of these prevention. We got to do the prevention with ear mites, okay? Ringworm. So again, this slide doesn't show up super great, but these are all pictures I took of cats at the shelter down in Salem. This is a slide, microscopic examination of the fungus here. Kitten with ringworm on its nose. This one here is actually a blacklight picture of the ear. Most of the ringworm in this area, if you put the patient in a dark room under black light, most of our common funguses here that cause ringworm will fluoresce in black light. It's kind of a cheap, dirty way to diagnose it. It is a fungus, and it's found everywhere in our soil. It loves to live on the immunosuppressed. Okay, so children, immunosuppressed adults. So for example, folks on chemotherapy, diabetics, HIV. It's just one of those diseases that get you when you're down. Really annoying disease, I tell people, this is one of the deal breakers in my world, because clients totally freak out about this disease because it's a fungus. It looks like a round, it says worm in its name. It's not a worm, it's a fungus. But clients just like freak out. They don't want to treat it. Everyone's going to get it. The kids won't be able to go to school. And those are probably not true. It is very annoying, but with treatment, 1 to 3 months, it'll clear up, okay? And if the client's willing to do a little bit of hygiene at home, it'll save the family and save the relationship with this cat. With the exception, again, if you have too many animals in your house and you cannot get the hygiene under control, whether it's fleas, ear mites, ringworm, this can be a huge disaster where now it lives in your house and everybody gets it all the time. Because once it's in there, especially if you have carpet, it's going to be very difficult to get rid of. So I'm back to this slide. I already showed this once, but we've reviewed fleas, the fungus, which is ringworm, and then we talked about ear mites. Lice. Lice, thankfully, is not a disease I see very often. Again, it's kind of a kitten disease that I see from colonies of cats that are malnourished. They have millions of other problems like fleas and ear mites and everything else. But it's one of my red flag diseases because if you're so sick that you now have lice, you're really in trouble. We have a major environmental problem or a malnourishment problem or something else is going on in this colony of cats so that it's got lice. Lice are very species specific. Cat lice like cats, horse lice like horses. Human lice, just read another article, now officially resistant to all over-the-counter treatments. Yay. But anyway, not my problem right now, but there are several flea products that will kill lice even though they are not licensed for that. But I will tell you, as much as I hate lime dip is one of my favorite treatments for lice because lime dip will strip the eggs right off the hair. And short of picking every single egg off of the hair, nothing takes the eggs off the hair, so they continue to hatch. And you have to keep retreating them. So I like lime dip for that reason. You can kill ringworm and lice with lime dip. I had in my notes there, oh, I forgot to say something. If there's a little plus mark by your bug, it's zoonotic. That means there's something about that could potentially make our human friends sick as well, okay? I have Demodex, scabies, Khaleesi, and even bed bugs question mark on there because it's really important as we go on our little tour here to understand that although regionally we don't see a lot of these kind of parasites, I don't see a lot of the Demodex, scabies, and Khaleesi, without a biopsy, they can be very difficult to diagnose. So it makes me a little crazy when clients don't want to do a biopsy. That sounds so extreme. I wouldn't recommend it if I wasn't really looking for something difficult to diagnose. These are treatable diseases, but they're very hard to treat if I don't know what it is. We see more and more through the animal welfare groups, cats and dogs that are being imported from strange places. I saw a giant Pyrenees, I don't even remember now, it was a giant breed of some kind that came from China, wherever they're eating the dogs. Anyway, this festival where they eat dogs, and a bunch of people got these dogs out. But this dog, I've never seen a dog from China, but they have different bugs. And so I think it's really important to understand the world's kind of shrinking, and so we try to be really open-minded. If we have something odd, let's get a skin scraping, let's culture it, let's get a biopsy so we know what's going on, partly to keep track of it, because if this is a new phenomenon, it's potentially contagious to other animals or people, it's our job to figure that out and let the state vet know that we've got a new infectious disease problem. So I just put them out there because, again, these are some of these weird red flag things. Scabies. Scabies is really a human problem. We don't see it too much in pets, but when I do, we know we've got an environmental issue in the house. Bed bugs don't live on cats and dogs, but there are a couple reports of the cat getting a dermatitis from the bed bugs. There is no treatment that you can put on the pet to eliminate something like bed bugs. You have to treat the environment. Okay, so these are real problems that we pretty much can eliminate with good hygiene and good population control. Okay, we're going to go on to the snot part of our tour. We did the scales. This should be another disease that I sort of love, but I don't love the upper respiratory problems because upper respiratory disease is so contagious and so common, and all the shelters, we all struggle at every level with cats who come in with bad colds. These are pictures right out of the clinic. This one's from Salem. This one was found like in a trash can in Lake Oswego. This kitten came in and her eyes were pasted shut. And so we peeled them open enough to get a picture of her. But these are, I have grouped all together the herpes, feline Khaleesi virus, and then the bacterial ones, Mycoplasma, Bordetella, and chlamydia. Okay? I used to just talk about herpes and Khaleesi virus because we have vaccines for these things, and we think of them as feline-specific problems. But more and more, again, with cultures, I'm seeing that, yes, it's herpes, but the cat also has Mycoplasma. Or, yes, it has herpes, but it's also got some Bordetella. Or maybe that eye infection isn't herpes and it's actually chlamydia. So these are important distinctions because we love to give cats with upper respiratory antibiotics, and that's actually legitimate. I mean, we really need to probably get them on antibiotics. 2 summers ago, we had a huge amount of animals coming out of Southern California, and the dogs were all arriving with Mycoplasma pneumonia. This was super contagious to all the animals in the shelter, and including humans. So again, it's important to understand what the bug is. Now, the viral testing for these, not so good. I mean, do not get your heart set on going in and finding out if this is herpes. Of course it's herpes. Every cat has herpes. Let's accept this. But the bigger question is, does it have Bordetella or one of the bacterial components along with it, okay? There are really pretty good vaccines for this. In my opinion, I think vaccines are really important with upper respiratory complexes. And so that will help protect against the viral part of that phenomenon. And even when the cat's a chronic carrier, I think the vaccine is very helpful. So again, prevention has to do with controlling your population, using good hygiene, getting those vaccines going, okay, even in the face of disease with these cats. The reason I sort of loathe them was not all that other stuff I just said. The reason I loathe this particular phenomenon, the snot part of what happens to cats, is that really a good number of these cats become chronic shedders and chronic carriers, and they live with these snotty noses and runny, gooey eyeballs their whole life. And it's really frustrating and really sad to try and figure out what to do with this cat long term, A, so it doesn't get other cats sick, but B, so it's not miserable with a gross, stuffy nose its whole life. I do warn clients, chronic stuffy noses, anything chronic, okay, chronic ear infection, chronic asthma, chronic irritable bowel disease, chronic rhinitis, those snotty noses, we believe now, okay, maybe as high as 1 in 5 of those cats will convert and develop nasal lymphoma. Okay, chronic inflammation is malignant. This is probably true for stress in our lives as well. But the point is, it's really important to try and address the entire lifestyle of this cat. Its nutrition, its stress level, its entertainment, its exercise. Does it need immunostimulants? Does it need probiotics? This isn't a box of Clavamox and see you next year. This is forever. I have to deal with this forever. And yes, it'll be on antibiotics sometimes, but I really need clients to understand that recurring and chronic upper respiratory disease in cats is incredibly miserable for the cat and can become impossible to treat. So for me, I loathe this disease because it could be 20 years of snotty nose. And very easily becomes resistant to antibiotics. And cats suck to medicate for the general population. And so for me to say, oh, Mrs. Jones, I think we can fix this, but I want you to give this cat a pill every 12 hours for 3 months. Yeah, no. It's like 3 days maybe. So anyway, it's frustrating to me. It's frustrating to the client. It kills kittens. I mean, I really don't like the upper respiratory. The other thing is, and I'm sure everybody here in the shelter world knows this, but we're very lucky in the Portland area that we have this amazing foster system that will take these snotty kittens and rehab them for adoption. A lot of places just have to euthanize them. They come in with a snotty nose, done, 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 done. Like, not even going to try. It's too contagious, and it will take at least 2 weeks to get it better. It could be months. Khaleesi cats, okay, Khaleesi virus. We're going to talk a little bit about that because, oh, let me back up. Ooh, Dawn. Dawn's cat. So Dawn's kitten has some chronic problems associated with upper respiratory disease, but I'll back up a little bit. So the chronic eye problems are equally annoying as the nose ones, but usually less malignant, okay? This kitten in particular has developed a web of scar tissue. It's covering her entire cornea. Now, you know, honestly, I don't think that kitten really cares that it can't see that well. But the problem is it continues to flare and drain and flare and drain. Okay, so it itches and she could get ulcers in there and it could rupture. I mean, this is just a nightmare for the client trying to deal with this eyeball. If it will quiet down, this cat can live just fine with a big web of scar tissue. I don't really care about that part. It's the ongoing infection and irritation, okay? Ultimately, we remove these eyes if we can't get them better and comfortable. We already talked about the sinus infections, okay? I want to talk just a minute about stomatitis because it's another disease that we do not understand very well, but I think there has to be an infectious disease component to it. But stomatitis is the inflammation of the entire mouth of the cat. I'm not talking about just a little spot of gum redness. I'm talking about fleshy red hamburger gums throughout the mouth. The back of the mouth, you open it and it's fleshy. It looks like tumors back there. They get these sore throats. They can't swallow. They don't want to eat. They don't groom themselves. So I think more and more we're going to see that this is going to be linked to things like Khaleesi virus. Okay, a lot of cats get Khaleesi virus. It's pretty annoying because it can cause ulcers in the mouth and a lot of the same upper respiratory problems. But there's a subset of cats that become chronic carriers and get these horrible mouths that look, again, that picture now is kind of washed out, but you can go online and see horrible Khaleesi mouths, right? So I have to now tell this client, this might only be a 2 or 3 year old cat. This isn't a cat with like rotten, I never brush my teeth mouth. Okay, those are poodles. Cats don't usually get rotten, I don't brush my teeth mouth. Poodles do. This cat has something else going on. This could be Bartonella. This could be Khaleesi virus. This could be, in my opinion, allergic to fleas. Okay, anything that pisses off this cat's immune system could cause its mouth to blow up like this. So now I'm like, okay, well, we get some antibiotics, maybe some pain medication. Do we do steroids? Does this cat have FIV? I mean, we'll talk about these things. What's the underlying condition is what I'm trying to say. Okay, so is there any underlying condition I can deal with at this point? And let's say I've ruled all that out and the cat doesn't have FIV and it doesn't have fleas or Bartonella or any of these other things. And now I have to say, well, Mrs. Jones, our options are muddle along with pain medication as needed, maybe steroids, which have long-term side effects. I will go ahead and take your $2,000 now and pull all those teeth. Let's just pull them all. And that we now maybe give that a 50-50 chance of remission. Well, that sounds amazing. I mean, is there anything I can do to prevent this? I don't know. This is a very important phenomenon that I deal with because it kills cats and it makes owners miserable. And it's super expensive to even try to fix these. And I give them 50-50. Shelter brings me these cats. If it doesn't have FIV, and I'm like, I could pull all its teeth, even at shelter rate, it's going to be $1,000. What does the shelter do? I'm going to tell you to spend the $1,000 and put it in rehab for 90 days before you decide what to do with this cat. Well, who has those kind of resources? So this is a big problem. I don't like this disease either because it's like jousting windmills. Hopefully we'll get this figured out. But it's an immune reaction. I think a lot of them are an infectious disease problem. Okay. All right, we're moving on to squirts. We could talk about respiratory disease all day long. Diarrhea. Just about anything will give a cat diarrhea. Just about anything will cause cats to vomit. But they love to get diarrhea, especially as kittens, okay? This was a handful of poo that I picked out of a carrier there on the left at the shelter, and this is a picture of Isospora, which is a coccidia on my microscope. See it all the time, every day, every day, every day. So we'll talk about the different categories of diarrhea because, again, diarrhea is one of those things where in theory, if you can get it diagnosed, it's going to be treatable, but how long is the owner going to put up with this? Like, I know the clock is ticking. I got to get this figured out, or this client ain't going to put up with it. And I don't know that I would either, because poop all over the place is an infectious disease problem for the cat and for the people, okay? So you got to get diarrhea figured out. Kittens and outdoor cats. So anybody born outside or who goes outside, okay, they're going to get diarrhea from walking around in the dirt, from eating birds and mice, from eating snails, slugs, worms, whatever it is the cats eat. And cats will eat more than you think. I've had cats vomit up Easter eggs and refried beans. But they found this stuff outside, right? Okay. So most infectious diarrhea, though, comes from contaminated soil. and water. And funny thing about the Northwest here, because we generally do have a lot of standing water, and we have this infectious diarrhea, especially in our, not particularly worms, but our single-celled organisms like Giardia, okay? Super common. In fact, when I first graduated, we had an outbreak in Clackamas County of Giardia in a subset of people. And the sentinels were the animals, and it was in the water. Southern Oregon had a cryptosporosis outbreak. I mean, these happen. So, the state vet tries to track this stuff too, but as a rule, anything outdoors is coming into all the time infected feces in the soil and the water, okay? And we're going to talk a little bit specifically about some of these. We'll come back to Panleuk in a second. Oops, too far. In your notes, I've got them listed. We've got our worm department, because clients like to talk about worms. When a client says worms, they're usually talking about tapeworm. That's fine. But when we talk about roundworms, what a lot of people don't realize is that really we have to pretend that every kitten and every puppy is born with roundworms. They get them from their mother, okay? It's super contagious. They pass it through the milk. So there are a few breeders out there that do a nice job, and the dogs don't pass it to the puppies, but I can pretty much guarantee you if a kitten's born outside, it's got roundworms. They got them from their mom, okay? The mom got it from eating birds and rodents, and the cycle starts all over from there. Tapeworm, again, from eating birds, fleas, and rodents. I already mentioned Giardia, Coccidia, Trichomonas, Cryptosporidium, okay? We have much better fecal testing available now. IDEXX offers, maybe Antec does too, but IDEXX offers a diarrhea panel. And it's, the days of just floating poop and looking for worms, and those days are going away. This technology is taking the stool sample and looking for DNA. They want to know if there's DNA from that parasite in there. And that's really cool because it doesn't take a lot of sample or a high load to get the diagnosis, okay? And the crazy thing is how many infectious diarrhea cases I get diagnosed with this PCR test that I know they're getting from eating raw food. And we could talk about raw diet sometime, but I'm not a fan. And kittens get horrible diarrhea, which they can give to their people from eating the raw food. So we keep that in mind with things like Giardia, especially in Cryptosporidium. We'll talk a little bit about viruses here in a minute, but the big ones are feline Panleukopenia and probably a little bit of coronavirus, and we're going to come back to that under systemic disease. The bacterial ones, Salmonella, E. coli, all the usual suspects that we hear about in foodborne illness, okay? Dogs and cats carry these, and it may not make them sick, but we have quite a few people now that really like to use their animals in therapy programs. Well, where do these dogs go? Dornbecker. Should you be feeding that dog raw food diet if it's going to Dornbecker? It's got like salmonella all over it. Like, it makes me nuts. People, don't use raw diet, especially if you're going to be around immunosuppressed people. But we're diagnosing it on these fecal PCRs all the time. The obvious answer is to limit how much hunting these cats are doing, okay, eating birds and mice. We'll talk about environmental control kind of at the end. Oregon Public Broadcasting did a little ditty on the catios. Did you hear that article? It was super cool. Like 1,200 people showed up. Yeah. I'm going to talk just for a minute about Panleukopenia because this disease is more common than people realize. It's pretty easy to diagnose as a rule. The vaccine is excellent, very protective. The problem is that this is a red flag disease where we have a ground zero infectious disease problem in a population, okay? It very rarely sort of just appears. It doesn't do that. It lives in a population, usually feral cats, or colony or cats or community cats that are pretty friendly but nobody really owns them, and then they get a young one in, and distemper, Panleukopenia pops up, and it will wipe out, I say on average without intervention, 75% to 90% of the colony dead within 2 weeks. It's bad, and they suffer. It is an awful virus because they're sick and dead if they're lucky within 3 days, but they can be sick for a week, and they will have miserable protracted vomiting and diarrhea. It's just coming out of every end of the poor cat, and they die of septicemia and dehydration. It is incredibly difficult to treat once the disease sets in, but more importantly, it is extremely contagious amongst other cats, young cats especially. So, oh my goodness, please vaccinate your cat for distemper. Everybody's probably pretty familiar with the systemic diseases, and I'm going to go through those pretty quickly because, again, with systemic disease, these are diseases that can pop up anywhere at any time and can have really weird presentations, okay? FIV, not a disease I worry a lot about, pretty easy to diagnose. FIV cats tend to live a long time with a pretty normal life. FIV cats are some of my favorite because they were probably total badasses until they got neutered, and now they'll roll with anything. So I love FIV cats as a rule. They do tend to suffer that stomatitis complex. They get weird skin problems. In the end, we lose a lot of them to bone marrow disease. They are susceptible to other weird illnesses. So, I'm careful with FIV cats. They need to be kept inside with parasite control and good nutrition. But I don't live in fear of FIV. We know now, spay-neuter has really dampened the rate of FIV. But there are few out there that still fight even once they're neutered, so they continue to spread it. And of course, the tomcats are giving it to the queens and kittens, things like this. That is a really sad note about leukemia. You already knew that. But leukemia is always on my radar because it's a tricky little bug. It should be pretty easy to diagnose, but it can hide, right? So we get a few cats who float through the shelter system, they tested negative, and then 2 years later they pop up positive. And it's really frustrating because now this family is bonded to this cat. They've only had it a year or two, and it's deathly ill, and it's going to die probably in the next year or two. Leukemia is incredibly frustrating because once the disease sets in, we're very limited on what we can do for these cats. Again, of course, good nutrition, low stress will help the cat live longer and feel better, but I have tried, everything from nutrition to chemotherapy to keep these cats comfortable. They're just kind of a wild card because some of them look great and go on for years, and then we lose about half of them in middle age to cancer, leukemia, or lymphoma. They develop a solid tumor. But this virus is a real nasty bug in that it hides in the bone marrow. It tends to kill the host fairly early in life, but if it hides in the bone marrow, it'll reemerge in midlife, and then we lose them to leukemia or lymphoma. So, and then once that happens, we're like, but my hope is with leukemia, because of the bizarre nature of the virus and how it behaves, it will, as we work on it, will give us good insight on how to deal with certain cancers, but immune-mediated disease like FIP. So we'll talk about FIP too. This is, of course, every veterinarian's sort of nightmare disease. Most of us understand now that I don't want to go into a ton of technical detail about FIP because there's a lot of good information about feline coronavirus, okay? The feline coronavirus we believe to be ubiquitous, okay? So every cat born outside, which is most cats born outside, have been exposed to this feline virus. They've been exposed to feline coronavirus, okay? Now, most cats, 97 to 99% of them, the virus kind of makes its way, might have a little diarrhea, done. You don't even know they were sick, okay? In the normal world, we will still lose 1 to 3%, we think, depending on whose numbers you look at. That virus will mutate into something new, and the host, the cat's immune system, has a bad reaction, and it will actually cause this little molecule, if you will, this little bug to form. and that starts to deposit in the tissues, okay? Just like cancer. It behaves, in my opinion, very similar to cancer, certain kinds of cancer. Okay, so once the disease starts to progress, right now, and we'll talk about some new stuff coming out, but right now the disease is considered fatal. Most of us know this, we accept that. It's very hard for clients to accept. This is the disease I tell you, if you see it, I tell clients this because us in the animal welfare world see a lot of it, but clients don't tend to see this a lot, and if they do, it's like being struck by lightning, I hope, okay? That they see one, they got their heart broken, this was the kid's cat, blah, blah, blah. Hopefully they'll never see another case of it because once they develop symptoms, you're done, okay? It's a matter of time, and got to talk about quality of life and euthanasia. There's no good vaccine for it. There is a vaccine for it, but its efficacy is very questionable. So nobody routinely uses it. AAFP does not recommend it, okay? This, to me, if I am seeing higher rates, if I'm getting 10 to 15% positive FIP cats, say, in a foster home situation, maybe your prize foster parent now has had 3 FIP cats in the last year, there's a problem in that house. You either have a really virulent coronavirus that easily converts to FIP, and now it's living in this house. We have a hygiene problem in this home, diarrhea everywhere. Something's wrong. So at some point when I start to see higher stats of it, it's another red flag. Something's wrong with the environment. We got too many cats, there's stress, the nutrition, something's off. And I try to get that location depopulated because they either have a really virulent bug or they have a major hygiene problem in this house. So this is a disease I do see all the time and deal with all the time. It destroys owners, this disease, because it is so frustrating to diagnose it. There's not one good test. There are like 5 tests that you can run and put the pieces all together. It kind of looks like FIP. We already know in here it's FIP. But to convince an owner they're going to have to kill their brand new kitten, and maybe it's probably FIP, that does not fly with people. They do not like that kind of answer. Yes, ma'am?
Where their bellies feel kind of jelly-like?
Right. So the wet form, they get the fluid either in their belly or they get the fluid in their lungs. The dry form, in my opinion, I usually see just chronic wasting and neurologic problems. Okay, so their behavior changes and they seizure, but they don't grow. They're odd mentally. With the dry FIP cats, they tend to get to like 4 pounds and start to lose weight.
Which is more common?
In my world, it's a pretty 50-50 split. I kind of feel like maybe a little bit more of the wet ones, but that's probably just because they're easier to diagnose, okay? With the wet form of the FIP, if you have a fluid sample from their belly, there's a pretty good DNA test for that. But it's just not all the cats have that fluid sample for us to diagnose the FIP, okay? We can talk a little bit more about FIP later if people want to, because I want to talk about the next 3 really quickly. The rest, so the discussion is designed that I kind of got through my agenda, which what I thought was important, but the next 3 are important for other reasons. And then I have a list at the end of kind of others, less common, okay? These are my special mention bugs, okay? Rabies is a special mention because rabies is a very, very serious zoonotic disease in most parts of the world. They're about to lose Ethiopia. Just read an article. Ethiopia is about to lose their wild fox to rabies. It's going to kill, they're extinct from rabies. But this is a really important human pathogen. Okay, so rabies is fatal. Okay, so this is one of I talk about my red flag diseases. This is one of my seatbelt diseases. Poor Randy's probably heard this, but we talk about the seatbelt disease or seatbelt in general because I wear my seatbelt not necessarily because it's the law. I wear my seatbelt because even though I'm unlikely to have an accident today, if I did not wear my seatbelt and I was in an accident, it's going to be bad. If you wear your seatbelt and you're in an accident, you're probably going to live and probably be okay. But if you drive without your seatbelt and you have that accident, you're probably going to be maimed horribly or killed, right? So rabies is a seatbelt disease. You must vaccinate your cat for rabies because cats will catch bats when they're sick with rabies. They come in the house. The bat comes in the house, and the cat's going to catch that bat. I promise you, I've already seen it 3 times in the last 15 years. The cat caught the bat in the house. Cats, if it's not vaccinated for rabies, your choices are to quarantine for 6 months, depending on its vaccine status. This is worst case scenario, but your choices are to quarantine for 6 months, or I could decapitate your cat and send it for testing. Oh, good. That sounds fun. Why don't we just vaccinate the cat? Because the cat then would only be in quarantine 10 days and probably going to keep its head. I don't like to argue about rabies vaccines. I think people should just vaccinate their cat for rabies, especially those first 2 or 3 years. Just get the cat vaccinated and don't go down this road. We have rabid bats in Oregon, and the state vet reports on those stats every year. Thankfully, we don't see a ton of it, but I will tell you, the Midwest, the East Coast, they have tons of rabies, tons of it in their skunks and their raccoons or fox, okay? Not fun disease to deal with. Just vaccinate your cat, your pets, okay, for rabies. Whoa, we skipped one. Okay, Toxoplasma. I'm going to bring this up because this is a pet peeve of mine. Cats are the definitive host for the single-celled organism called Toxoplasma, okay? Toxoplasma is a disease they pick up from eating birds and mice. It rarely makes the cat sick, okay? And it's not super easy to diagnose. You can do some antibody titers and treat the cat, and the cat gets better. But the reason I bring this infectious disease up is that the media likes to make cats sound like these evil little gremlins that are making people sick with Toxoplasma. And again, if you read Medline or any of the human medical literature, people who get Toxoplasma are immunosuppressed and or eating raw meat. They get it from the same source the cats do. They are eating steak tartare. They get toxo, and they blame the cat. And it makes me crazy because like 80% of veterinarians are women, and we all have kids, and we don't get sick with Toxoplasma because I don't eat cat poop, and I don't eat raw meat. Quit blaming the cat. Okay, the cat might get sick with toxo, but I'm sick of it. I'm sick of hearing this, that you're going to get toxo from your cat. I do think there's some mental illness issues that could lead to overpopulation in homes. And now we have a hygiene problem, and there might be cat poop all over that house, and they are going to get toxo from the cat poop because it's everywhere, okay? That's a different issue. That's an environmental problem and a hygiene problem and a population problem. Oops, I forgot one. Oh, no, I did it. Okay. I'm going to give one special mention to lungworm because the state vet is collecting huge amounts of data right now on cats and cat poop testing and whatever. And it turns out lungworm, kind of a funny little disease that cats can get from eating snails and slugs. But usually what's happened is they ate a mouse that just ate the slug or the snail. But the lungworm is a nasty bug that gets into their lungs and can give them, it'll look like asthma, it could look like pneumonia. It's just that we haven't been looking for it. It's super treatable. We just haven't been looking for it. And then I diagnosed asthma and gave it steroids. And that probably killed it because lungworms went crazy. Yeah, we got to be looking for lungworm, okay? It's really easy to treat, but it's out there, and we see it actually Salem. I don't know what it is with Salem.
This year. I never heard of it.
Yeah.
The first time I ever had a cat.
For some reason, that group in Salem, you guys got a lot of lungworm. A lot.
A lot?
Yeah, and so we, with the shelter group, we were diagnosing it. We would take the kittens and spay them and do a transtracheal wash at the same time, which is kind of risky. But these are shelter cats, and we're trying to figure out what's going on. And we wanted cultures, too, in case it was a bad bacteria like mycoplasma or something else. And lo and behold, like gobs of lungworms are washing out of their trach tubes. Yeah, really easy to treat, and we got to be looking for it. I've got some other fun stuff on there, and most of these are not major illnesses that I see. In fact, in the last 20 years, I've never diagnosed heartworm disease. We do see some of these fungal. Cryptococcosis used to be considered a tropical disease that caused these weird skin lesions on cats, kind of looks like cancer. About 10 years ago, Vancouver Island and that area of Washington, right off Canada, had a huge outbreak. I mean, huge. They had an outbreak of it. Totally bizarre. So if we're not looking for these things with biopsies and cultures, we're not going to find it, and it's going to be darn near impossible to get it treated. So lepto is a problem we see in dogs. So people want to talk about lepto, but lepto is another disease we probably should be looking for. Cats love to get kidney failure as old cats. Well, how many of these cats as young cats maybe were exposed to lepto and had some kidney damage? I don't know. I don't have the answers to these. These are questions I'm asking because I think we should be looking for it. Stomach worm, never seen one. Diagnose it with a scope, I guess. I don't know. Strongyl will kill it. So I'm going to vote for Strongyl. Like, I think everybody's kind of getting the message. Okay, we're going to do takeaway. Infectious disease is super common. They can be difficult to diagnose. Lots of them are preventable. Lots of them are zoonotic. To me, this is more often than not, they indicate a stressed environment. And I don't mean a stressed human necessarily. I think we as a culture are really stressed. I feel sorry for cats. But I'm talking about too many pets in the home, too small a space, not enough resources, poor nutrition, not enough parasite control. Okay? These diseases don't exist in some little corner of my world. These diseases indicate an environmental and mental health problem with the cat in the colony that I'm dealing with. Cats are wild animals, okay? We semi-domesticated these animals, but it's really not too much different than keeping squirrels or raccoons in the house. They're not like so in your face like a dog, but they have needs. They have really big needs, and if you meet those needs, they're easier to live with, and they don't tend to get us sick. Yeah, let's have catio. I mean, I think as a culture, we're evolving towards this idea that cats probably shouldn't be free roaming. Pet cats, they're killing off all the birds. They're getting parasites. They're making immunosuppressed people sick. They get hit by cars, you know. I just think that we're getting to a point where we're starting to realize they need more space. They need some wild space, but it needs to be maybe controlled, okay? So the catio idea is getting really popular. Yeah. So I'm going to stop because that was probably a little bit more than 45 minutes. Okay.